Do mRNA vaccines actually alter human DNA? The answer is a little complicated, but more importantly, it's not what you think. The idea that a vaccine could sneak into your genes, rewrite your code, and change who you are on a cellular level, that fear spread faster than any virus ever could. It was plastered across group chats, whispered in churches, and debated at dinner tables, and just like that, science became suspect. But what if the issue wasn't the science? What if the real danger was how governments handled it? Hi, I'm Kale, and today we're diving deep into the miracle of modern medicine, the mRNA vaccine, and the global trust crisis that may have permanently damaged its legacy. For over 100 years, we've known the blueprint of life. DNA makes RNA, and RNA makes proteins. That's the central dogma of molecular biology, discovered and clarified in the 1950s by Francis Crick, co-discoverer of the DNA double helix, and ever since, no one has ever been able to prove otherwise. mRNA, short for messenger RNA, is a courier. It carries genetic instructions from DNA, which resides inside the nucleus, out into the cytoplasm of the cell, where ribosome, assisted by transfer RNA and ribosomal RNA, translates those instructions into proteins. This flow of information is one-directional. Once the protein is made, there's no going backward. mRNA doesn't sneak into your nucleus and start scribbling on your DNA like a rogue editor. This is why your body can make all kinds of faulty proteins, misfolded, defective, or incomplete, and still never mutate your genes. No reverse transcription, no reverse translation, no altered DNA. Now, to be fair, some fringe lab studies, like one in 2021, using liver cells, hinted at mRNA vaccines turning into DNA, but that's never been shown in people. In reality, mRNA vaccines don't change your DNA. So why did people think it would? To understand that, we need to talk about what mRNA vaccines really are and how they became both a scientific breakthrough and a public relations disaster. For centuries, vaccines have stood as humanity's shield. Smallpox eradicated, polio nearly gone. But traditional vaccines were slow, complex, and dependent on cultivating viruses in labs. The world needed something faster, something more adaptable for the age of mutating pathogens. And in the 1990s, a Hungarian-born scientist named Katalin Karikó believed she had found the answer. She envisioned a new kind of vaccine, one that wouldn't inject pieces of a virus, but instead teach your body how to make a harmless version of the viral protein using mRNA. The protein would act as a wanted poster for your immune system, more like, if you see this guy, attack. But every time she tried, the immune system overreacted. The immune system could not distinguish between the poster printer and the guy. The synthetic mRNA was seen as an invader and destroyed before it could do its job. Her research was rejected again and again, funding dried up, and at one point she was even demoted from her position at the University of Pennsylvania. Still, she didn't stop. In 2005, she and her collaborator, immunologist Drew Weissman, made a pivotal discovery. By tweaking just a small piece of the mRNA code, they could sneak past the immune system without raising alarms. This wasn't just a fix, it was a revolution. Yet, no one noticed. For years, pharmaceutical industries ignored this breakthrough. There was no incentive to invest in a risky new method when traditional vaccines already worked. And then, COVID-19 happened. The world went into lockdown. Economies froze, hospitals overflowed, scientists raced against time, and just as fear reached its peak, mRNA stepped into the spotlight. Within days of SARS-CoV-2 genome being published, companies like Pfizer and Moderna had already designed vaccine candidates using Kariko's mRNA technology. No live virus needed, no cell cultures, just code. By December 2020, less than a year after the virus emerged, mRNA vaccines were being injected into arms around the world. It was the fastest vaccine rollout in history. And the results? Over 90% effectiveness, fewer severe hospitalizations, an adaptable platform that could be rewritten in weeks to fight future variants. But something strange happened. Even as the science shined, the skepticism grew. People began asking questions, reasonable ones at first. How was this done so fast? Is this even safe? Will there be long-term effects? But before scientists could finish answering, the mandates came. Governments around the world enforced vaccine requirements, workplaces made shots compulsory, colleges, airlines, and even local grocery stores adopted strict protocols. And with each mandate, another seed of distrust was planted. See, vaccines are supposed to be about public health, but when tied to employment, travel, education, and even civil liberties, they become political weapons. Instead of winning hearts with data, governments wielded policy like a club. People weren't just hesitant anymore, they were angry. The fear that mRNA could alter DNA, though scientifically baseless, gained traction not because of the science, but because of the force. By trying to protect the population, governments may have unintentionally created a new kind of virus, mass distrust. Let's be clear, mRNA vaccines were not rushed. The research spanned decades, the trials were rigorous, the oversight was constant. But when you force someone's hand, they stop listening. And when those same governments later walked back policies like mask mandates or revealed inconsistencies in early COVID data, the damage was done. People started to think, quote, if they were wrong about masks, what else were they wrong about? End quote. That erosion of trust didn't just affect the COVID response, it lit a fire under the anti-vax movement. Once a fringe ideology, now a growing mainstream presence. Even vaccine centrists, those who once lined up for flu shots without question, are now saying, next time, I'll wait. That next time could be a deadly one. Imagine a future outbreak, something new, something worse. The scientific community once again develops a revolutionary mRNA vaccine in record time, but this time, no one wants it. They don't trust the studies, they don't trust the data, and most of all, they don't trust the government. It will take years, maybe decades, to rebuild that faith. So what now? If governments want to restore trust, they must treat the public like partners, not problems. That means transparency with data even when it's messy, admitting when early policies missed the mark, welcoming dissenting voices in scientific discourse, ending the culture of coercion in public health. Trust isn't restored with mandates, it's earned with honesty, humility, and time. mRNA vaccine is a miracle, a technology born from struggle, forged by underdogs, proven in the crisis, and now threatened not by science, but by politics. In October 2023, Katalin Karikó and Drew Weissman were jointly awarded the Nobel Prize in Physiology or Medicine for modifications that enabled the development of effective mRNA vaccines against COVID-19. Katalin Karikó's decade of sacrifice gave the world a gift, a way to outpace disease, to prevent the next pandemic before it starts. But unless governments step back and let the success speak for itself, this miracle might just get lost in the noise. Thanks for watching, stay curious, stay skeptical, and I'll see you next time on Double Helix.
Double Helix, coded to reality.